Hey, everybody, it's Dr. Brian Prax. We are going to be getting started shortly. There's a few more people coming on in here. Wanted to let you know we are streaming this live at YouTube and also Facebook. So not only are you going to be attending, but many other people are attending as well. Yes, I'll be turning my camera on in just 1 second. I'm getting my makeup put on. All right, just kidding. I'm not really getting my makeup put on. But I'm really looking forward to starting the seminar. We do have a 2:30 start. I'm looking at my clock. It says 2:30. I'm thinking I want to give just a minute, maybe two. I am an on-time person. I know those of you who are in that, well, I guess you're no longer in the waiting room. You're in this webinar, but I know those of you who are in the webinar are on time and early people as well. But if you don't mind, let's just wait a couple of minutes, let some stragglers come on in here. By the way, it is being recorded. And I said we are streaming live. I'm super excited about that. And both on Facebook and my YouTube channel. For those of you who don't know, I do have a Facebook support group. And if you are interested in that, of course, Facebook is awesome. There's no charge there. But you'd look up Dr. Brian, what is it? Dr. Brian Prax's support. Oh, Kevin, what is that? I think it's, yeah, Reversing Neuropathy Support Group. That's what it is. So just get onto Facebook and look up Reversing Neuropathy Support Group. That's my support group. As you would imagine, we support people there. I have also a YouTube channel that, well, I'm biased, but I think it's pretty awesome. It's content loaded, lots of great stuff and how I care for my neuropathy patients. And really, I just focus not on selling my program or anything like that. I just offer advice. Last time I checked, I think I have over 200 videos there. We take care of knees as well, so you might see a few things on knees. You'll see some things on nutrition. I'm a big fan of nutrition, and I am starting my video now. So I'm on. Here I am. I'm an actual person here, and it looks like it is 2:22, and I am chomping at the bit. I'm super excited sitting here in Charlottesville, Virginia. And many of you are from farther away. I think I have some people right here in Charlottesville as well. We did broadcast this and announce it to the state or the Commonwealth of Virginia, but I know that some of you have shared it beyond, so it's going to be really exciting to see how far people have virtually traveled to attend this webinar. I've gone through this and really worked these slides, and I put together as much great content as we can get. And I'm expecting this to be about 30 minutes long. Again, chock full of information. So if you're here for information about reversing neuropathy, if it's for yourself or for a loved one or even for a friend, I'm really glad you're here. I would really encourage you to shut off all those distractions. I know I've been to some seminars and I look over and I see people who've been paying these things are over there on their phone and they're writing things down, reading books, snoring, sleeping. You came here for a reason. You were drawn here for a reason. You saw the Facebook ad or whatever it was, someone sent you a link. Let's just really go zen with this and see what you can get out of this. So try and put down all distractions. I would encourage the old school paper and pen, or if you want to use your smartphone and take notes, snap pictures. That's a good way of grabbing things. A lot of us do that in the webinars and seminars we go to. You have your phone, just hold it up there and, you know, oh, that's a good one. And you could just take a picture of your computer monitor. If it's on your phone, you can do what's it called, a screen capture, if you know how to do that. But anyway, I see more and more people are coming in. I'm super excited. I'm going to go ahead and get started. It is 234, which sounds like a really good number to get started. So here we are. We're going to get started with Dr. Prax's Reversing Neuropathy webinar. So this is me. I wrote a book called Reversing Neuropathy, Making the Impossible Possible. I'm not here to sell books, but if you are interested, again, I'm biased, but It's a great book, chock full of information. You can find it, guess where? Amazon.com, right? We can get everything at Amazon.com. But yeah, you can just look it up. It's called Reversing Neuropathy, Making the Impossible Possible. In fact, I think I have a slide. It's right there. So that's my book. And the webinar today is how to get lasting relief from pain, numbness, burning, and cramping without drugs or surgery. So I want to go back and say, not just how to get lasting relief, what if we could actually reverse it? That's what I'm talking about reversing this thing. So I will tell you, at the end, I will be offering a webinar exclusive offer. Now you have to stick around to the end in order to get the offer. I'll just tell you right now, the offer is an opportunity to work with us. And yes, we do it virtually. We do telemedicine. But that's not really what it's all about. It's about giving you information. So don't hang up. If you're here to gather information about neuropathy, peripheral neuropathy, and you're here to start unraveling this thing so that you can really begin to live the life that you were endeavored to achieve, then you are in the right place as well. So if you're here to get information, stick around. We are going to give you lots of information. So hopefully I have your permission to make an offer at the end. Let's dive in. Slide 3, please. It all starts with me and my mom. And I know on your screen, just like on mine, that's a very grainy picture. But there I am with my mom. That's a good 15 years ago when she was diagnosed with Lou Gehrig's disease. ALS, terrible condition, affects the brain, and particularly the parts of the brain that control the muscles really throughout the body, but not only in the periphery, but also on the inside. Eventually it gets the lungs, ability to speak. It's a terrible condition. And here I was, as I had been out as an alternative practitioner for 15 years. I didn't really have much for mom. And I had to sit there and listen to the doctor give her 6 months. You know what I mean? I'm going to give you 6 months. That was the prognosis of how long that he thought that she would live. And I had to sit there and think about that. The sad thing is that although mom was an alcoholic, an abuser of prescription and other types of medications, and smoker and all those things, the sad thing was that she had just given up alcohol, and that was tough. And tougher than that is she had just quit cigarettes like a few years before. And when she got this diagnosis, I said, Mom, wow, we got to do all we can. I knew at that point, like I do today, that we got to look at nutrition and exercise. She really dialed it in on nutrition and exercise. And she was able to expand the quality of her life and even the quantity of her life. Instead of 6 months, she made it 6 years. And I think I start to understand what it's all about when she says this was a blessing. And I'm like, how in the world could you call this a blessing? This terrible thing where one day you no longer have the ability to use this finger, and then it's that finger, then it's on the other side. Now my leg is weak, swallowing is getting tough, and then you can start to hear it in her voice. Losing ability to speak, and then the lungs difficult to breathe, and then digestion became tough, couldn't hold. It was terrible. But I'm starting to get it now with this whole death and dying thing, that mom says it was a blessing because it drew her family closer. We were able to work through many wrinkles and crap that kind of comes out over all the years. We were really able to work through a lot of that, and she really considered it a blessing. This is a trip that we took long ago in Mexico, shortly after she got the diagnosis. So this led me into a quest to figure out how to understand and help the body to reverse neuropathy. So I really thank Mom for that. That's why I'm so passionate about helping folks just like you to reverse your own neuropathy. So love you, Mom. Go to the next slide. Now, what would a neuropathy workshop be without defining what is peripheral neuropathy? So we got to start with the real basic. I just shared with you a central neuropathy. That's something that affects the brain. So anything that affects the center, the brain or the spinal cord, right? Like Christopher Reeves had a central neuropathy. He damaged his spinal cord. Mom had Lou Gehrig's disease up here in the brain. Those are central neuropathies. Stroke, that's another example of a neuropathy. MS, that's another example. Those are central neuropathies. Well, peripheral neuropathies are those nerves that exit the spinal cord up here in the neck, and then the ones that leave the spinal cord in the lower back. That would be called the peripheral nervous system. Now, anything that affects those peripheral nerves would be an opathy. So just basic, basic Latin or Greek, I forget what it is, but an opathy means a problem with. So that's going to be your burning and your tingling and your numbness and many of those symptoms that you feel already. That peripheral neuropathy is what usually affects our arms, hands, fingers, and more commonly, our legs, our feet, and our toes. That would be the peripheral nervous system. So I hope that makes sense. That's peripheral neuropathy, is you got a problem with these peripheral nerves here. Let's flip to the next slide. All right, this is a good one, defining most or many of the 100 known causes of neuropathy. The number one cause is going to be a lack of blood flow. So reduced blood flow. You got to think about it. Blood flows not only to the skin, it goes to the muscles, the stomach, the brain, blood flow to the brain. Blood flow even goes to the heart itself. Did you realize that? The heart can't get blood from inside of it. So it has arteries that come off the heart and go back and feed the heart. But there's also little teeny tiny nerves that are surrounding every one of your little teeny tiny nerves. And yes, every one of your big, large nerves, like the sciatic nerve as well. Well, when we have trouble, which are damaging the blood vessels that go to your nerves, just like the picture shows, when those diseased blood vessels begin to shrivel and eventually die, there's just literally no way that the nerve that it's supplying the oxygen and the glucose and all those nutrients to, there's no way that it can continue to live, at least thrive, right? Do what it's supposed to do. So reduced blood flow equals damaged nerves. So if your doctor isn't working with you on some vascular or some blood flow circulation strategy, we're missing the boat right there. So we've got to make sure, number one, we got to get good circulation to those nerves. All right, so we'll give you some stats here. I'll whip right through these, but you are not alone with this neuropathy. We're estimating, or we get 24 million diagnoses from peripheral neuropathy every single year. That's 8% of the US population. But more scary than that is that literally millions go undiagnosed, whether they just think it's aging or, maybe I'm sitting around too long or their doctor doesn't diagnose it, but many people go undiagnosed with neuropathy. So it's probably way higher than 24 million. The point there I want you to get is you're not alone in your suffering. Sometimes we feel like we're on our own island, but you're not. Lots of other people have it. And just another plug, it's completely free. But if you want to get into my support group, you're going to check out Reversing Neuropathy Support Group. If that doesn't get it, type in Dr. Brian Prax support group. But we have a support group to help you out, just to know that you're not alone. Now, this neuropathy, it can occur at any age, but because it's chronic, which means that it takes a long time to get there, it generally is going to affect their older population. Most of my neuropathy patients, not all, but most of them are going to be senior citizens or older, okay, like the super senior, okay? My oldest patient, by the way, was 99 when she started. Now, that's a positive attitude to, make changes in your life and realize, I'm 99, I might not live next week. She made it to 100 and even 101, and then I lost track. She reversed her neuropathy, but that was my oldest patient. She was 99, and during the program, she turned 100. So hopefully you don't have to wait that long. Now, almost a third of all neuropathies are linked to diabetes. So if you have diabetes or pre-diabetes, or you're on your way and not regulating that blood sugar so good, you've got to have a strategy. And metformin and insulin is not the right strategy. That makes your A1C look good, but you're still causing damage to those peripheral arteries, and then those peripheral nerves are dying off as well. So your doctor, if you've been to him or her, has probably always already run a diabetes check. But you definitely want to make sure that diabetes is ruled out. If you have it, yes, we can help you. That constitutes the majority of our neuropathy patients. But there's 99 other causes. Actually, there's one more cause that we'll share with you later on in the slide. But there's 100 other causes that are known for peripheral neuropathy. Topping the list is diabetes, pre-diabetes. We already talked about circulation issues. Lots of things can cause circulation issues, but it's that microcirculation, right? To those little teeny tiny nerves down in the feet and the toes, the hands and the fingers. Well, back problems, neck problems, herniated disc, spinal stenosis, those are commonly called pinched nerves. If you got a pinched nerve in the back and that nerve goes down into your extremity, that's going to cause a problem. A pinched nerve is a peripheral neuropathy because it's affecting the peripheral nerves. I've had patients come in after surgeries like shoulder or hip surgeries. It's not common, but I have seen those surgery or back surgeries even. I've seen those lead to peripheral neuropathy. So you may be one of those in that group. Autoimmune diseases, those are things like celiac disease, Hashimoto's disease, even rheumatoid arthritis. Those are conditions that can lead to neuropathies. All right, now, so here's the surprise, or maybe not a surprise to you, but infections like viral or bacterial infections can be a cause of neuropathy. So what are we thinking? If you watch the news, you've probably heard of this thing. Yes, COVID. I've seen a few cases of COVID coming in. People got COVID, and then from that, they're suffering with peripheral neuropathy. So viral, bacterial, COVID, that's what I would call the 101st known cause of peripheral neuropathy. Alcohol abuse. Just answered a question on my YouTube channel. A young man, I think he was 25, has abused alcohol. He said he's very open and transparent, but he says he's abusing alcohol, and he's developed alcohol-induced neuropathy at 25. I've cared for those. They're tough, but obviously the first thing you have to do, you got to stop. You got to stop that offending activity. Stop drinking the alcohol. Okay, if you're a diabetic, you've got to stop drinking and eating the sugar. I'm the first one to tell you. Of course I'm not. I know your doctor said that. Watch your sugar, watch your carbs. I'm here to tell you it's killing your nerves. It's killing your nerves. So write that down. Neuropathy kills sugar kills nerves. You write that down. Okay, got something out of this. All right. Now, many medications can cause it as well. Not always. So I'm not saying it's a blanket statement right here, but things, certain antibiotics. Cipro, that's the first one that comes to mind. It's got a black box warning label on it. It can cause so many things. Neuropathy is one of them. I've worked on them. They're tough. Can I help you? I don't know. Was yours caused by that? I don't know, but I've seen them. I've helped them. They're tough. Statin medications, not all the time, but I have seen statin medications as a main cause of peripheral neuropathy. Don't go jumping off your statins. I didn't say that. I'm just saying somebody's got to start looking at the side effects of these different medications, and could they be an actual contributing factor or the main factor of your neuropathy? I don't know. I'm not saying so, but we've got to at least open it up for a discussion. So liver disease, kidney disease, thyroid conditions, and more. There's 101 causes, right? Neuropathy goes much farther beyond than just burning, tingling, numbness, cramping, wake you up at night kind of condition. I just want you to know that 1 out of 3 seniors fall. 1 out of 3 fall each and every year. 20 to 30% suffer moderate to severe injuries. Whoa. And 10% of all these falls are fatal. What if you can't feel your feet because you got numb feet, because you got this thing called peripheral neuropathy? What if you're in that boat? That you can't balance very well. If your brain doesn't know where your feet are, How are you supposed to walk? How are you supposed to maneuver up steps or down steps? You can, but if you're walking around on blocks of wood or ice, that makes it really hard. It makes it really easy to fall. You could be one step away from one of these statistics. We don't want that. Okay, so it's just things to know about. It's a lot more serious than just some symptoms in your feet. This is scary too. 86,000 people experience amputation of a limb each year because of neuropathy. 10 an hour. That scares me. I don't want to have anything cut off. You've heard this before, but now you're sitting here thinking, well, what do I have? What are my choices? What are my options? Probably been to your doctor already. And that would be the third one. You could go to your primary doctor, or maybe you even get sent to a neurologist. And what do? They give you drugs. You know which ones. Gabapentin, also known as Neurontin or Lyrica. Those are the top ones. Maybe you get an opioid, but whoops, we killed too many people with opioid. I'm sure you've heard of the opioid epidemic. It's very dangerous. But anyway, whether it's an opioid or a gabapentin or Lyrica or Tylenol, all you're really doing is covering up your symptoms. Let's be honest, okay? You're just covering up your symptoms. I don't like symptoms either, but if my car is making a very screechy, loud noise like something's not right, and the mechanic tells me to just get a louder stereo system and crank it up, I'm thinking, I probably don't have a good mechanic. Is that what your doctor's doing? Is that the best they got? The answer is, unfortunately, that's all they got. And that's why I'll tell you, you just got to learn to live with it. There's nothing that can be done, okay? If you just sit around and just wait and see if it'll get better on its own, doing what you're doing, it's not going to work. And again, that's why I titled the book, Making the Impossible Possible, because most of my patients come in very skeptical. My doctor said there's nothing that can be done. My neurologist said you can't treat it. There's not, just take this gabapentin and have a nice life, or you're getting older, right? So I'm just curious, rhetorical question. How many of you have heard that? There's nothing that can be done. Yeah, I can see you. I can see you nodding your head. Nothing that can be done at all. Truth is, there's a lot that can be done. Little quick story on Mrs. Plant right here. Look at that. Look at that gorgeous plant. Isn't she beautiful? But if you look closely, you'll see some owies right here on this plant. And it's a little bit faded, this plant right here. So the story was, we went on vacation over Christmas and we shut the blinds, right? And it was pretty cold in here. And we didn't water her. 2 weeks I came off of vacation, she was slumped on the floor. It was such a sad scenario. My poor plant, beautiful as she was, slumped all the way on the floor. We need to do emergency something or other here. Of course, we saw a lot of dead leaves. We saw the stems that were broken off, and we had to do some serious surgeries, and we had to clip out a lot of dead ones. But what was the first thing we did? You can probably imagine. Open up the blinds, bring in the sunlight. Okay. Next thing, get her some water. So we did the clipping, opened up the screen. We got her some water, and then we had to wait. Now I will be honest with you, she's not as full as she was before the vacation, but she's gorgeous. Look at her. She's gorgeous. And you know what? She was made by nature, and so are you. Now you can say God, nature, whatever you want to say. I don't want to step on any toes, but we were made in nature to have the ability to self-heal, just like Mrs. Plant over here. That's how the neuropathy program works. We have fancy tools. We have a lot of cool stuff that helps speed this along, kind of like adding fertilizer to the plant. But it's nature that does the healing. Your body is already trying to heal itself. We just need someone who knows what to do. I knew it needed water. I knew it needed sunlight. We did some soil amendments, and then we kind of had to wait. And she's gorgeous, and you're gorgeous too. Your nerves can heal. Now, the truth of the matter is, and we cover this a little later, but if she was completely dead and there was all brown, not that likely we're going to bring her back. Now, I'm good. But I'm not Jesus or anybody like that. I don't produce miracles. I just work along with what nature does. Okay. So just like the plant, your body is trying to heal itself. So I want to get over this whole thing like it's impossible. There's nothing that can be done. You got nature backing you. That's the exciting thing. That's the good news. So all medications for neuropathy are only going to mask your symptoms. They do not correct the underlying cause. Don't be fooled. You're not fixing it. There's never a time when your doctor is going to say, you're done. You're totally done. You can get off your gabapentin now. It healed you. Not going to heal you. Only your body can heal you. Okay. So now stick around, you guys. We're going to give you some real strategies. So hang in there. But look, this is crazy because Neurontin has side effects, and a lot of my patients tell me, I feel that too. Infection, ataxia, balance, okay? Blurred vision, diplopia, that's double vision, and dizziness. Those are just the top line. What about drowsiness, fatigue? If you just took any one of those three, you would realize that Neurontin can cause any of those. That's going to cause some balance problems right there, okay? But it can lead to headache, peripheral edema, that means swelling, tremor, okay, weight gain. A lot of my patients say they've gained weight on gabapentin, visual field loss, accidental injury, think about falls, and dry mouth. Other side effects, these top ones are common. These down here are called less common, but look, abnormality in thinking. Whoa, have you noticed that? Amnesia, forgetfulness, arthralgia, joint pain, asthenia, weird movements that things just move on their own, cognitive dysfunction, walk into a room, can't remember why you walked in there. Maybe that's not old age. Maybe it's a side effect of gabapentin. Confusion, edema, again, swelling. Look at this one. Neuropathy. What? I challenge you to look it up. Take a picture of it with your phone. I'm going to leave it there for a second. Take a picture. It's water. It's what humans are made to drink. So neuropathy, specifically burning, tingling, and numbness. You look it up. Go to drugs.com or the mayoclinic.com, and you'll see that as a side effect of gabapentin. It could be making your peripheral neuropathy worse. Isn't that crazy? The exact drug you're given to help is actually possibly causing it worse. It's nuts. Sinusitis, speech disturbance, vertigo. There's some more dizzy issues, visual disturbance, increased appetite, twitching, and the list goes on and on. That's not it all by itself. But a lot of my patients say, "Oh, made me feel like I was crazy. I had crazy thoughts. I had weird dreams. I got all these things going on inside my brain. I don't know where they came from." Could be a side effect. Every drug has a side effect, right? You know that. Every single drug, even aspirin, has a side effect. Aspirin can actually cause damage to your stomach. It causes bleeding in the stomach. Ugh. 20,000 Americans die from that stuff. All right. Gabapentin is an anti-seizure medication. That means it was approved by the FDA for seizures, not for peripheral neuropathy. It's used off-label, but they found it does help with the symptoms, but it's really made for seizures. I have a video on my YouTube channel. I'm pretty sure it's been viewed the most, and it's on Neurontin. So if you Google Dr. Brian Prax, I think you just put in gabapentin, and you'll see the research that I shared. It got a lot of hits. A lot of people liked it. Tons of comments on it. But a lot of people are pretty upset that it does slow down and actually kill synapses inside your brain. It's research out of Stanton. It's not Dr. Brian Prax saying that. But again, it does not stop the progression of neuropathy. It's not going to make it stop. Now, Lyrica is a cousin of neuropathy. It was the next generation of neuropathy. And I don't know if you've noticed this, but I see this and I hear it a lot from my patients, but severe swelling is a side effect of Lyrica. Suicidal thoughts, increased risk of cancer, bleeding, irregular heartbeat, muscle pain, like cramping, rapid weight gain, severe dizziness. So this stuff can actually cause balance problems in addition to the neuropathy symptoms as well. You probably have heard about this group, the NIH, right? We've heard about the NIH lately, giving us information on COVID, but the National Institute of Health is quoted as saying that peripheral nerves have the ability to regenerate. as long as the underlying nerve cell has not been killed. It's just like my plant. As long as we didn't kill it, it can come back. Maybe not as pretty as it was when it started, but it can come back. Can your nerves come back? As long as they're not dead, all right? That's what we want to look at. So really the rule of thumb is the 85% rule. So do you have 85% or less nerve loss? If it's less than 85%, there's a good chance we can help you out. If it's higher than that, the chances get less and less and less. How much percent loss do you have? I don't know. You have to evaluate it. That's called a sensory examination. It has to be done correctly, and it's not just an X-ray or an MRI or an EMG. It's a sensory exam. So that has to be done to determine how much weight loss is done. Now, the nuts and bolts, if you want to get the camera out and start taking pictures, here's the secret sauce. This is how we do it. This is what I talk about in the book and the YouTube. This is the blueprint to neuropathy. It's a three-pronged approach. You got to have a metabolic approach. Got to have an approach to improve circulation. You must. And the last one is you need to rebuild the nerves. 3 separate things. Got to have all of them. Okay. So what is metabolic? What's metabolic? All right. Strap on your seatbelt. Put on your safety helmet. This is what I mean by metabolic. Now this encompasses a lot of things. I know that probably scares you, like, oh, I gotta be a granola. He's gonna tell me how I gotta eat, and I gotta eat vegetables and be a vegan and all that stuff. I'm just saying, you gotta eat good food. Nerves can heal, according to the NIH and according to this doctor, but they're tough. They're tough to heal. They take a long time, and they need all the right ingredients in order to heal. They just need that. I recommend we eat really good food. Now, if you're looking at there and saying, "Oh, I don't like broccoli. Oh, I don't like tofu. I don't want to eat tofu." This is just a sample. But the whole point of this is going to affect your metabolism, your endocrinology, your hormonal system, your gut, your digestion, your immune system. We've got to take a look at that. If there's any one thing you do from this webinar, if you work with me or don't work with me, any one thing you do, yes, start looking at diet. For sure. The next thing that's critically important is to have a strategy for circulation. One of the best ways to get circulation is just plain old walking and exercise. We already know that. But what if your feet are burning and tingling and in so much pain you can't stand to be on your feet? You got a bicycle, you got the rower, get in the water. I know it's freezing out there on the sea or the lake or whatever, but we got this thing called a gym. So there's plenty of ways that you can do it. I know it's tough, but one of the ways that we do it is an at-home unit called the infrared lights. Tons of research, I can share that with you, but the tons of research indicates that the right frequency of infrared lights will stimulate local circulation. Local means like if you put it on the foot, you're going to get better circulation at the foot. You put it on the hands, you're going to improve the circulation to the hands right on the spot. Okay, so we've got to have a good circulation strategy. There's tons of equipment and tons of things out there, and some of you may be going online and looking for the infrared lights. You can buy them as cheap as $50 and several $1,000s. We need to get the right one with the right frequency. I've looked around the world. I've tried the cheap ones. I've tried the expensive ones. We got the right one. It has to be the right one, but we've got to get the correct infrared light therapy. This next one, we need to rebuild the nerves. So that's what I was talking about before. This is an inventor. Dr. Phillips is the inventor who created an electrical stimulation machine, not a TENS. If you're thinking, is it a TENS? It's not a TENS. TENS blocks pain. This unit right here is used at the Cancer Centers of America, Sloan Kettering, and other cancer centers for chemotherapy-induced neuropathy. And it works. If they use it there because they know that the chemo is going to cause neuropathy and they start it right in the beginning, that's smart. As you start killing off the nerves, you want to start repairing them so you have as little damage as possible. We have made that unit available for home usage. So for most of my patients, they get this unit and you would use it at home. together with the right infrared lights. So you do the infrared lights at home, and then right after getting the circulation there, right after that, then you do the electrical stimulation with this tool that's used at the Cancer Centers of America. Put that together with the correct anti-inflammatory diet. We now shoot our results up into the 85 to 90% success range. Isn't that awesome? I think it's awesome. All right. How come my doctor doesn't know about this? Probably frequently asked question number 2 or number 3. Well, number 1, medical students receive less than 20 hours of nutritional education over 4 years of schooling. Wow. Less than 20 hours. They just don't get it. Okay. They don't get the education. Number 2, medical students receive no education on alternative forms of therapies. What they do get is the way they practice is the way they're trained. They're trained to give drugs and do surgeries to eradicate or alleviate symptoms. They're going to give you a drug to relieve your symptoms, but not to fix your problem. And the last reason that your doctor doesn't know about it or use this is because of Medicare guidelines, section 2251.3. We'll cover that on the next slide, but that is the most irksome slide that you'll see here. So I'm just going to go right into it. Why doesn't insurance pay? Now, they might pay some of it, but they're not going to pay all of it. And that's because other insurance carriers like Blue Cross Blue Shield and others are going to follow Medicare guidelines. So watch this. Section 2251.3, a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life. Sounds pretty good so far. Or a therapy that is performed to maintain or prevent deterioration, and this is the key word right here. Deterioration of a chronic condition is deemed not medically necessary. This might be one that you can take a picture of. I would encourage you to call your representative, your senator, call Joe Biden himself, but this has to change. It's not currently accepted right now because peripheral neuropathy is considered a chronic condition. And it is. It's a long-term condition. If you take a fall down a flight of steps, if you need an amputation because your diabetes has gotten so bad, if you need a wheelchair or a ramp, they're going to cover all of that. Your drugs for your high blood pressure and high cholesterol and even your opioids, they'll cover all of that because those are acute considerations. But to fix the underlying problem, it's a chronic condition, not medically necessary. Okay, so I said before that you had 3 choices. There's actually a 4th. Again, you could do nothing. It's going to get worse. You could learn to live with it like your doctor suggested. It's going to get worse. It's a progressive condition. Or you can go to your doctor or go to your neurologist and you can get some drugs, which is only going to cover up your symptoms and it's going to get worse. Or you could see if you qualify for the Blueprint to Neuropathy program. I've been talking about it already. It's what we do. It works. 85 to 90% of the time, it works. Why? Because nature is already on our side. It's already trying to heal those nerves. It's the same as the plant. It works because the plant's trying to survive. Your body is trying to survive. We just need a few tools to push that along to help that healing process. We need to get the right anti-inflammatory diet and a few other things. Step out of the way and watch nature flourish. So it's pretty cool how that works. So I like this guy. Well, who should get evaluated? Should I get in there? I don't know. I could just imagine him saying, what do you know? Should I do it? So who should get evaluated? It's a longer list than this. I selected 9. I could probably come up with 50, but these are the top symptoms that I hear about. If you have burning, tingling, or numbness, cramping, sharp electric pain, restless leg syndrome, that often goes along with neuropathy very frequently. Balance problems, falling, we talked about that. Can't sleep due to foot or hand pain. Or 9, I clumped up a bunch of weird sensations. I've heard things as far as it feels like there's a piece of cardboard or leather under my feet. It feels like I'm walking on little bubbles, you know, like like water or something under my feet. Some guy once told me it feels like rats are chewing the end of my feet all day long. Wow, that would be really hard. That'd be really hard to sleep if rats were chewing on your foot, right? I can't do my tie. I can't button up my buttons anymore. It's hard to zip up my fly. If you're having one of those symptoms, or your writing is getting bad, and the list goes on and on, but if you have symptoms like these or others like neuropathy, you should probably check it out and see if you would qualify. Imagine, let's just dream for a second. Imagine if you or your loved one could actually sleep through the night peacefully. Imagine that. What would life be like for you? Or walking with confidence and surety that you're not just going to fall over, feeling steady again. Imagine going shopping or taking trips or going on that cruise. Okay, enjoying those family outings, what you love to do. Imagine being able to drive again. A lot of my patients can't even feel the pedals. Imagine that. What if you could heal this and even feel 10 or 20, or some patients even 30 years younger? I mean, just imagine. I just want to share real quick, and then we'll move on. Roger Bannister was told, and many other athletes in the 50s, I think, was told that crossing the 4-minute mile in a run for a human, it's impossible. Can't be done. No way. Your heart's going to blow up. There's no way your muscles will be able to handle that. He broke the 4-minute mile. He did it. And I guess he didn't get the memo or something, but he was determined to do it. Nobody in history that we knew of was able to run a mile faster than 4 minutes until Roger Bannister did it. Now there's college kids that are breaking the 4-minute mile. There's thousands of people who've been able to break the 4-minute mile. It may just be a mindset thing. Maybe it's your mindset that you can't heal this neuropathy, or maybe you think you don't deserve it, or maybe your doctor just doesn't know and says there's nothing that can be done. But I want to tell you, if one human like Roger Bannister could run the 4-minute mile, or if one human like James, who we'll show you later, was able to reverse the neuropathy, that means that it's possible, hence making the impossible possible. So imagine that. So getting started, here's the action. You're wondering, what is it? What are we going to do? So here comes the offer. I'm going to recommend that you get the 16-point neuropathy severity exam. We need to see how severe your neuropathy is. Would you be a good candidate? Is it too far gone? Is it not bad enough? Okay, we need to see if your neuropathy is way too far gone or not. And I know you're thinking like, oh, forget it. I'm not even going to do it. I know mine is severe. It may not be. We need to actually run the test. So we've got to determine the extent of your nerve loss and whether we can help you or not. So there's the 16-point neuropathy severity exam. The top part, I know you're all looking at the price here already, but the top part is the comprehensive consultation. And this part is key. How many times do you go to your doctor? He's over here keying on the keyboard, and all you see is the side or the back of his head or her head like this. And you're telling him all about your burning and your tingling and how bad your sleep is. And he's kind of trying to keep up with his notes over here. You know more get done. He says, okay, so what I'm going to do for you, and he gets his little pad out, and he goes, what I'm going to do for you is write you a prescription for gabapentin. You're going to try this for 6 weeks, and go ahead to the front to your pharmacy and get that. I'll see you in 6 weeks. Well, let's see how it goes. Now, we don't do that. You're not going to see the back of my head. You're going to see the front of my face. You're going to see my staff person who takes notes with me. We're going to actually look at you. We're going to actually listen. We're going to want to know everything about this neuropathy. I'm going to read every single line that you write on our intake form, and we're actually going to listen. I want to know how you're not able to shop. I want to know how you can't drive, or you're afraid that you won't be able to drive. I want to get into the weeds with this neuropathy and figure out exactly how it's affecting your life. So we listen. That's called the comprehensive consultation. We do the 16-point neuropathy severity exam. Now, we do that here in the clinic in Charlottesville. It's best if you can get in here, but I know some of you are coming from quite a distance. And for those of you who can't make it, it's too far or whatever, yes, we do telemedicine. Telemedicine is done over Zoom, Facebook Live, not Facebook Live, what is it? Facebook Messenger or whatever the Google has a chat, whatever strategy we can do. But I need a visual on you. So you would simply need some sort of laptop or some camera, probably like you have on your phone is not as good, but on your computer. And you're going to need an assistant. If we're not going to do it here in the clinic, you're going to need an assistant. Somebody's got to be my hands for me. Somebody's got to put the equipment that you have in your house, things like a butter knife, things like something that vibrates like your cell phone and a cold pack. So these are the ways that we can actually identify how bad the nerves are. So we send you a video. My staff will coach you on how to gather all this stuff. The training video shows you and your assistant exactly how to do it. Then we get on, we do the consultation, we do the severity exam through the computer. And whether it's here in the clinic or in the comfort of your home through the Zoom, that normal value is $287. But I've just done about a half an hour of education, which is going to save a half an hour or more of my time here in the clinic teaching you about neuropathy and that it can be done. So yeah, we're offering that gift to you for $87. Okay. So $87 is going to include the first day where we do the consultation and where we also do the 16-point exam. And it's also going to include the second visit called the report of findings. Well, that's where I report to you what I found, and that's where I report to you whether you'd be a good candidate in the program or not. And then at that point, you can decide whether you want to move forward or not. Now, I just put the offer up. It's something that looks like this right here at the bottom. It says book a free call. So I want to tell you about that. When you click on a free call, you will not have to pay $87 for the call. That's called a strategy call. I want to make it easy for you. Some of you are thinking, well, I don't know if I would be a good candidate. Maybe I should, maybe I shouldn't. And I want to have one of my staff, and both of them are on the line right now, both Cynthia and Kevin. They are on the line, and they're gonna they'll be the ones that will go over a strategy call with you, asking you a few questions, trying to get an idea as to whether you'd be a good candidate or not before you pay the $87. So that's another gift I want to give you. 5 to 10 minutes with my staff just so we can learn a little bit more about it and see if you'd be a good candidate. So all you need to do is you're going to click on book a free call. So it should be on the right, somewhere on the right side of your screen. Book a free call. That's going to take you to my calendar. You'll have options, days. You click on which day works for you. And then from there, you'll see the various appointments that we have available. And we have over 100, last time I checked, over 100 people on the line right now. So there's only a limited number of these calls. I would encourage you to click quickly because we only have so many numbers of me right here. But click on that. You'll get the free strategy call. From there, if my team thinks that you'd be a good candidate, then we can do the $87 and we'll book that for a time when you can come in here or we can meet you in your house through the Zoom. So I talked to you about James. That's the guy at the top. That's a firefighter. He did our virtual program. He was in, dang it, where was he? He was in, I think it was Idaho, Iowa. I always get those two mixed up. I think Idaho. Anyway, he's a firefighter, severe neuropathy in hands and feet. And he got to the point in 3 months, this is 3 months, his neuropathy in his feet are 90% better. He lost a ton of weight, improving his diet. The one below, he lost even 50 pounds. I know it says 20 right there, but his doctor told him it's impossible. There's nothing you can do for your neuropathy. He completely reversed it. These are just a few of them. And I put this gentleman in right here. He's a local guy. He's a Charlottesville guy. He is actually the son of one of our senior couple who comes in here. Carpenter, works with his hands all the time, right? So if you're a carpenter working with things like saws and DeWalt drills and things like that, you kind of need to feel your hands. That's his livelihood. So he was able to reverse 100% of that neuropathy. So I really want you to be on my next webinar. We'll have your picture up there. Wouldn't that be awesome? You telling everybody how great you've done. So I just have two questions for you. If you're still hanging around, love having you here. If you're still hanging around, that means you haven't clicked the book a free call yet. And I'm just wondering, if not now, when? When is going to be a good time to do a strategy call? Listen, you're not signing up for an entire program. You're signing your life away. You're clicking on that and you're going to talk to my staff and just see if you ought to take the next step. It's a little teeny tiny thing you do. You click it, you figure out which day, which time works for you. We'll call and my staff will determine, is she going to be a good candidate? And the other thing is, what if? I mean, we were dreaming earlier, but what if? What if you could actually reverse it? And maybe a more realistic question in your case, what if you only were able to reverse half of your neuropathy? What if only half of your symptoms went away? Would that bum you out? Would that be good if half of your burning went away, or you could sleep half through the night instead of none? What if only half went away? What if all of it went away? What about 80%? I don't know. We wouldn't know until we first do the strategy call and then we do an exam. So those are the first and then the second step that needs to be done to see if we might be able to help you out. I'm not forcing anybody to do anything. If you do the strategy call and then you do the exam and I say I can help you and we talk about the investment and you decide, I can't do it right now, it's not the right time or whatever, I'm fine with that. What you've done is you've gathered information to see if it could help you out. Yes, I'll work with your doctor. If your doctor wants to do a peer-to-peer review call, I'm happy to do that. But guys, we need to take some action because the reality is if nothing changes, then nothing changes. I really encourage you, take a step. Is it scary? I don't know. I would want to know. A call takes you 5 to 10 minutes of your time. It's free. Take a step, click the button. Let's see if you'd be a good candidate. I've got some patients I got to get helping. It's been an honor and a privilege to speak with you. I hope you got a lot out of it. I look forward to seeing you here in the clinic or at your home through Zoom. I really, really, really want to help you out. Click the button, and we look forward to seeing you soon.